The COVID-19 pandemic has brought renewed urgency to the issue of paid family leave. The grassroots organization COVID Survivors for Change joined advocacy group Paid Leave for All to lobby Congress, meeting with several lawmakers yesterday. The plight of patients experiencing long-term symptoms is a particular area of concern, as well as the trauma of bereavement and isolation, which is also taking a massive toll on people across the country. So Chris Kocher is the Executive Director of COVID Survivors for Change and joins us now. Chris, thank you so much for joining us. Tell us about the conversations that you have had with lawmakers yesterday and why paid family leave is so important.
Sure, thanks for having me. Well, yesterday we met with more than 20 lawmakers on both sides of the aisle. We talked to both Republicans and Democrats, and we talked to them about how the pandemic has forced millions of Americans to choose between taking care of their family's health, taking care of their own health, and collecting a paycheck. And no one should have to make that choice. And paid leave would allow Americans to take the time off that they need after an illness or a traumatic event, after grieving the loss of a loved one, to make sure that they don't have to worry about putting food on the table or paying rent.
As vaccinations go up and infections and deaths go down, America is opening up more and more. What's it like for people who have lost close family members or who have been grievously ill themselves to see everyone so gleefully out and about and living their lives?
It's hard. I mean, people are thankful that people are getting vaccinated. People are thankful the numbers are coming down. The pandemic is beginning to come to an end. But the idea that people are moving on and celebrating and telling others that they need to move on and why are they still focused on COVID is hurtful. And I think we need to move together as a nation to support and recognize that we've been through this collective national trauma. And we need to continue to move forward and honor the millions of Americans that are living with the grief of COVID or the physical disability of COVID.
This is such an interesting time because there are people who have their experience with COVID is just from watching the news. No one they know ever got it, or the people that got it were hardly ever sick, and they never got it, and nothing about their lives changed. They kept their jobs, and everything's fine. And then there are other people that it has been incredibly traumatic. Loved ones have died. They haven't been able to see them. They haven't been able to go to funerals. Maybe they brought the virus home not knowing it, and there's the additional guilt of having other people sick. Long haulers, pleading with people to believe that they actually are sick and they're not over COVID. I don't think we definitely have never experienced anything like this, and it's so layered. And Vlad talked about the fact that a lot of people are just happy to get out and about, to eat on a patio. The weather's warm. What do you do if you're in that other category where COVID has actually not been that bad for you? How should you change your behavior? What do you do to remain cognizant and empathetic of others who have had a much different experience?
Yeah, well, look, I mean, everyone has been through a rough year. And so I think it's completely natural to say, I want to do things that I haven't been able to do because I can do them safely for the first time in 50 months. I can see family and friends that I haven't been able to in 50 months. We have, lots of folks who have not been able to do that. So I think people should be thankful and celebrate that less people are being sick. The pandemic is beginning to an end. But that doesn't mean that COVID is over. Millions of Americans, like you said, are living with the grief of loss. It's more than 600,000 lives taken. Millions of Americans are living with long haulers. And so you can do things like understand that for millions of Americans, going back to normal isn't their reality. And so continue to ask, if you do know people who have lost a loved one or are living with COVID, ask how they're doing. And we're launching a campaign for July 4th called Add Yellow. So let's celebrate that the pandemic is beginning to come to an end, like I said, but let's also add yellow to celebrate that and remember the lives that have been taken. Yellow has become a symbol of COVID loss and survival, and the Yellow Heart Memorial has become a way for loved ones to remember and honor their family and friends who have been infected by COVID. And so including yellow in your celebrations is a way to show that you're continuing to honor and stand with the millions of Americans who still have COVID.
It's an interesting idea, Chris, and I wonder, in researching this and your experience and what you've seen over the last couple of months, I would like to believe that Americans are still compassionate and always looking out for their neighbors. But Anne-Marie points out that we've never been through anything like this before, and what I focus on is the politicization of this pandemic. And so what it means now is you want to believe that Americans are caring and compassionate, and that we all believe that we should respect each other no matter, as long as it's not harming someone else. But the whole idea behind, for example, masks, where you should wear them, whether you should not wear them. If you wear a mask now in New York City and you are fully vaccinated, as I am, people think that you are somebody who has not been vaccinated, because that's generally the reasons why they tell us to wear the mask, right? If you're not vaccinated, wear a mask. But there are some people who are vaccinated who still feel comfortable wearing the mask because they don't want to, for whatever reason. My mother, for example, I'm thinking of my mom, still wears a mask, right, even though she's fully vaccinated. How should people try and step away from the politics of this all and just think about their neighbor, their colleague, their loved one, who, even if you didn't lose somebody, even if you don't know anybody who lost their life, has been through a really, really rough 16 months?
Yeah, I mean, well, first, just remember that people, like you said, are doing it for different reasons. So some people are continuing to wear a mask because they have certain conditions that maybe, may leave them more vulnerable. Because like myself, I have 2 small kids at home, so I'm still wearing a mask. And others are maybe making different choices for that reason. But I do want to believe that the American people are compassionate and are supportive of each other. And I think it is really important that we continue to look out for ways that we can support and help each other. In some ways, we have seen the best of humanity in the past 15 months. And of course, there have been challenges and with the politicization of all this. But I do believe that if we give people ways to show that they can support this community who have been through unimaginable loss, that millions of Americans will stand with this community and help them fight for the recognition of their loss, for the support and the services that they still need. Like I said, the kids that are living with long COVID that are going back to school, 40,000 children lost a parent in the past year. That's a lifetime of grief to deal with. And so how can we show up for these kids? How can we show up for these families in a way that is meaningful and shows that we are, collectively with them as a nation? And I think we will do that.
Just really quickly before we go, how do you feel about the reopening? Do you think, we're going too fast, or what's your take on it?
It does feel a little jarring. I was walking in Brooklyn last night and walked through it. We were outside, but walked through a space where people were outdoor and dining, and it still feels a little jarring. And I think that's what we have to remember, is that everyone is approaching this and from a different perspective. And for people who have lost a loved one or who are still living with COVID, that moving into these reopenings can feel a little bit re-traumatizing. And so just recognize that the way that you can support someone is by continuing to mask when you're around others and just to show support for people.
Yeah, it always strikes me that we're a nation of extremes. We go from one to the other very, very quickly without giving it much thought, without thinking about anybody but ourselves, and that sometimes can have problems because it's not an all or nothing. We just passed 600,000 deaths in this country from COVID-19. You wouldn't know that we are still seeing deaths in this country because a lot of what we're talking about, and let's face it, I include the media in this, are people out and about, enjoying their lives, going on vacation, throwing away their masks. And the reality is that there are still people that are sick. There are still some families who this Thanksgiving will not have somebody sitting at that dinner table. And I think if people just sit back and think about that a little, then perhaps we'll end this pandemic when it's really over a little better than we already are.
Absolutely.
Chris.
And I think let's do both. Let's move forward and celebrate that we can be together in a way that we couldn't even a few months ago, but also let's show that we can continue to recognize that we have millions of Americans have been through catastrophic loss, and let's show up to support them.
Indeed. Chris Kocher, thank you for coming on. Appreciate it. Really interesting discussion.